All right. Welcome to Community Chat, April 2026. Here we go. I'm going to admit this person here. Okay. So tonight we're talking about a super important topic, which is sleep. So many people struggle with poor sleep. So I'm so excited to dive into this. I've been wanting to talk about this for a long time. So let's do it. Let's just get right into it. Okay, once I get to my screen here. Okay, so before we get into too much details about sleep, I want to talk about what is considered good sleep. Some people say, I sleep 5 hours, but I feel fine, or I sleep 10 hours, and that's just how much sleep I need. What is considered healthy sleep? And that is a little bit of a nuanced situation. It is a little bit unique to each person. But what the American Academy of Sleep has set forth is at least 7 hours is considered good sleep, around 7 to 8 hours to be more specific on that. And that's looking at overall studies on health to give that determination for 7 hours. But what's even more important than duration is that sleep quality. And this is something we're going to be talking about. Cycles of non-REM and REM cycles each night and each lasting around 120 minutes. But we'll get into that. So short sleep, which is less than 6 hours, or long sleep, over 9 hours, has very considerable health risks to it. Increased risk of obesity if you sleep too little or too much, diabetes, stroke, cardiovascular disease, mental distress, and all-cause mortality. So these are very, very serious issues. So good enough reason with that, besides not feeling good if you're not sleeping well, to really dive in and find out ways that we can improve sleep. So I want to talk to you about this non-REM and REM sleep. We hear so much about REM sleep, but there's actually even more, equally important phases of sleep. So non-REM consists of 3 different phases, and one is that sleep onset. That's your transition from being awake to sleep. So just that little bit of time, 5% of total sleep. N2 is your light sleep phase. So this comprises 50% of total sleep time. And a lot of patients that I see, they spend probably more than this in that light sleep. They say anything can wake them up. My husband rolls over and I wake up, or someone sniffs and I wake up, and I just constantly stay in this light sleep phase. But surprisingly, that is 50% of total sleep time is in that light sleep phase. Then you have N3. This is your slow wave or your deep sleep. This is your deepest stage of sleep. This is high delta waves, and 20% of your total sleep time. This is in the first third of the night. So a lot of people will say that if they're going to wake up, it's a few hours after they have fallen asleep. And that's where it becomes a little bit more problematic with going back to sleep. And then is the famous REM sleep. So REM stands for rapid eye movements. This is complete muscle atonia. This is paralysis. You are asleep. There's no question about it. This is also where a lot of vivid dreaming takes place. It starts within the first 60 to 90 minutes of sleeping, thankfully. You usually get right into it pretty much, and it's about 20% of total sleep time. So you'll see, actually, the non-REM sleep, it has most of your sleeping components to it. But interestingly enough, dreaming, I just thought this was an interesting point. This doesn't mean too much for us, but dreaming doesn't only take place in REM sleep. Some people will say, well, I didn't dream at all, so I probably didn't get REM sleep. I probably wasn't in REM cycles. Or they'll say, I dreamt a lot, so I must have been in good REM cycles all night, but that's really not the case. But the REM sleep tends to be with those more vivid, long dreams. You ever have those dreams where it felt like they lasted like 2 hours? That is a little bit more synonymous with REM sleep. And they tend to be more story-like, as we've known from those dreams that we've had. So one thing I do want to talk about sleeping medications, which I am not against. I prescribe them. A lot of what we're going to talk about is naturally improving sleep, but sleep medicines are a normal part of everyone's daily life. Not everyone's, but many people's daily life. And so I wanted to break down a little bit of differences between these different sleeping medications. Some of them can be more helpful over time. Some of them are probably ones that you want to get off as soon as possible. And that is the first one, the benzodiazepines. So this is your medicines like Valium, Xanax, Ativan, Klonopin. These are your benzodiazepines. So these increase stage 2, which is that light sleep. Remember, that's what we're trying to. It is 50% of our total sleep, but we don't want any extra of that light sleep. It does decrease stage 3 and stage 4. Those are your deeper stages of sleep. And it decreases REM sleep, right? So this also can alter brain oscillations that are crucial for memory consolidation. So benzodiazepines have been linked to cognitive impairments, especially in older individuals with chronic use. You cannot abruptly stop benzodiazepines. You have to be weaned off of these. Very important. But I would say not a good long-term sleeping medication. And now you see why. It really can make big, not good changes over time. Now compare this to Zolpidem. Zolpidem is Ambien, is the brand name. So at higher doses, like 15 milligrams, there were significant decreases in REM sleep overall. But stage 3 and 4, those are your deeper sleeping stages, is actually comparable to natural sleep. Efficacy does tend to diminish over time. So sometimes you need higher doses or you need to switch to something else. So that's kind of frustrating about Zolpidem. And there are EEG changes with Zolpidem. EEG is basically like an EKG for your brain. And it looks at the cycles of your sleep. And so there are some EEG changes with Zolpidem. It can alter things. Now, I'm probably going to butcher these names because I don't use these names very often, but Daigo, Belsomra is a very common one, and then Quvavik. This class of medications does have a few more benefits compared to Zolpidem. So they have less cognitive impairment associated with these particular medications. They still carry some risks, like any medication does, of course. You can have some abnormal dreams, some nightmares, some sleep-related behaviors, but efficacy does not diminish like it does with Zolpidem. So that's an interesting fact. And it does produce sleep that is more closely resembling to natural sleep. So that is a huge benefit of that class of medications. Benadryl, the most or one of the most common used medications for sleeping. It's in many over-the-counter sleeping medications. There's some issues with Benadryl. Short-term use, probably okay. Long-term use does have some significant risks. There's not a ton of data on using Benadryl for long periods of time. However, the data that is out there does show some risks of cognitive impairment over time. It can increase your risk of developing dementia. And that's something that we want to decrease in us, of course, right? So shorter term use, definitely recommended when it comes to Benadryl. And if you're over 60, do not use it. It has worse effects on older individuals, urinary incontinence issues or urinary issues in general. Increased risk of falls, not a good medication to use if you're over 60, really. Melatonin is definitely famous for getting people to sleep. It actually does have quite a good safety profile compared to other sleeping agents. It can help you get to sleep, but it's not really going to help much with staying asleep because those are two differences, right? Some people, they struggle with both areas. They struggle with getting to sleep and they struggle with staying asleep. Melatonin can help get you there. It's not necessarily going to keep you sleeping throughout the night, but it can be helpful. I wanted to just touch briefly on progesterone. I do have many women on progesterone who are of perimenopause or menopause age range. I love progesterone For the right person, it can be very helpful. And I just wanted to talk about it because I do know do have several patients on it. So the difference with this, unlike benzodiazepines, which suppress stage 3 and 4, that deep sleep, and reduces REM sleep, progesterone, in fact, increases that slow wave delta waves, duration and intensity. It also does not, it didn't on studies cause any significant changes on EEG compared to like zolpidem and benzodiazepines. So that's a nice thing about it. And the dose that they studied was 300 milligrams. So some women will say, is that too high of a dose? Well, that's actually what they used for their study. So no, technically. So interesting facts about progesterone. So before we dive into sleep a bit further, I wanted to bring up these different sleep personalities. I just think this is fun, and it really can give you insight into your best times throughout the day. And that way you also don't get frustrated because of your situation and how it compares to someone else. You hear about these night owls or early birds, and people can like make fun of certain people. Oh, they're just a night owl. Like the morning is terrible for them. Well, these are actually personality traits. So we'll talk about this. I think it's really, really helpful to know what your chronotype is. And so it'll be fun. That way, I'd love to hear what your chronotype is. If you hear this and you figure out yours from this, send me a message. I'd love to hear it. So the lion, the lion is the early riser. They wake up between 5 and 6 a.m. Doesn't matter what time they go to sleep. They're going to be up 5 or 6, almost guaranteed. Most productive time for a lion is between 8 and 12 p.m. Many lions are already sending out emails at 6:30 a.m. They're the ones that you're getting those early messages from. That's just natural to them. Their brain's already turning on. But technically, overall, natural productive time is 8 to 12. They get into their afternoon slump because guess what? Everyone gets into an afternoon slump. It's very rare to not experience that because you're going to go through waves throughout the day where you're a little bit more alert and a little bit more tired. So their afternoon slump happens between that 1 to 3 p.m. time frame. Some lions get a creative rebound. So they get the second wind around 4 to 6, where it's like, oh, okay, I'm feeling okay now again. And then they're pretty much ready for bed. Brains shut off. They're done by 9 p.m. Ready for bed, maybe even earlier than that. Now, the bear, this is 50% of the population. So many people fall into this category. Their natural wake time is going to follow the sun. So maybe 7 to 8, or if you're in the Pacific Northwest, maybe 4:30 when the sun comes up in the summertime, right? Their natural or like most productive time frame is going to be between that 10 a.m. to 1 p.m. typically for them. They're going to hit an afternoon slump, 2 to 4, very rough for a bear. And then they might get a creative rebound. They might get this second wind that happens like 6 to 8. Okay, I'm feeling good again. I can get some things done. And then it doesn't show it on here, but usually like ready for bed, maybe 10, 11, usually in this situation. The wolf. So here is the night owl. Okay, this is an actual personality trait. These are artistic minds. These are the artists. Okay, morning doesn't start until noon. Ask a wolf to do something in the morning and it is torture. It is so difficult. Brain really starts waking up between that 12 to 3 time frame. Most focused at 4 to 7. These are when other people are still coming out of their afternoon slumps, right? The wolf is like near zeroed in. They're ready. But also the powerhouse comes alive in the night. So this is at 8 to 11. These are when, authors are writing their books or the musicians are doing their shows or things like that. They just turn on at that nighttime hour, which is why also they're like not waking up in the morning. The dolphin. So this is where so many people that I see, they fall into this category. This is a very sensitive sleeper. Maybe spend a lot of time in that N2 phase, that light sleep phase. I love this. Tired, but wired. Maybe wired with coffee. Fast talking, well-read, often a very intelligent person. Likes to get up early, but also so frustrated because the night was not fun. Like waking up with every little thing, and the dolphin has just gotten used to it. It's like, well, this is just how I sleep. Like I don't sleep well, so I've just worked around it. I still get frustrated because I don't sleep well, but I'm still going to keep moving, right? Most productive peak. This is important for the dolphin. If this is you, scheduling things between that 11 to 2 p.m. The brain is going, they're feeling really good. Afternoon slump, 2 to 5 p.m. Just put me out. I am so tired between that time frame. Then they get this second wind. All of a sudden it's like, okay, now my brain is totally turned on. It's 7 p.m. and I wish I would have had this energy at 9 a.m. That would have been nice. It is important for the dolphin to avoid screen time in that like later evening time frame, because we want the brain to start shutting down again. That way you can get to sleep. And so we're going to talk about why that is so important. So let's get into the nitty gritty, right? How do we improve sleep? This is why we are learning here, right? So one of the key, step number one, is lowering your temperature. This is so key. Who has been woken up because they are so hot in the night? Maybe their bed partner loves to have this like horribly thick blanket on the bed, or they like the temperature at, I don't know, 78 degrees or something like that. And it's just keeping you up at night. It is so important to lower the temperature in your room to start off with 68 to 70 degrees if you can do that. Another little trick to lowering your body temperature is actually showering or taking a bath before bed, because you warm up in that setting, especially like it has to be a warm shower. If you're a cold showering person, this is not going to work very well. Take a warm or hot shower or a bath before bed. Your body naturally cools down afterwards, so it's going to bring your heart rate down. It's going to prepare you for sleep. Screen time. We all know this, right? We've heard this so many times. Suppressing your screen time. Screens wake the body up and they tell your brain, you do not need to make melatonin right now. This person is wide awake. They're going to be doing things. So it's really important, as much as you can, to not be looking at the screen. I do have a lot of people, they'll listen to something, they'll listen to a video or a show or something when they're trying to sleep. And that tends to work a little bit better because it is distracting you from thinking about things and things like that. It's distracting you enough to go to sleep. That is very different than watching something in bed, doom scrolling. How many of us have done that? You start looking at reels or something like that, and before you know it, 45 minutes have gone by. Put the phone away or listen to something without focusing on it with your eyes. So incredibly important. Other thing is good to know about how long caffeine stays in your system. So I have a lot of people, they'll say, caffeine doesn't affect me. I can drink it before bed. That's fine. But technically, caffeine has a half-life of about 6 hours. So it's really nice thing to cut off caffeine by about 2 p.m. is a really good time frame to say, okay, we're done with this. So all of those metabolites are out of your system by the time you go to bed. Blood sugar. Okay, so food intake before bedtime. This is so important, and it is a tricky situation, especially if you are on weight loss medication or something where you are trying to focus on getting enough protein and fiber before the end of the day. If you are someone who does not sleep well and you typically eat until maybe a half hour before you go to bed, I would really strongly suggest that you try to cut that back. When you eat food, your digestive system has to sort of come alive and it has to break down food. It's also going to increase your heart rate to a certain degree because it's trying to digest food. It doesn't affect young people as much. A lot of times, like, babies, that's like a perfect example, right? It's like they need a full stomach, but to go to bed and to actually sleep through the night, right? As we get older each year, we need less and less intake before bed because our system is so much more sensitive to breaking down foods and digesting in the middle of the night. So as much as you can, try to cut it out. And then alcohol also. I would say alcohol is probably the number one drug used to sleep. Because it's kind of, it really works on GABA receptors to make you a little bit more tired, but alcohol will wake you up as you digest it. it'll wake you up in the middle of the night. Even if it's just a small amount of alertness in the night, people tend to sleep a lot better if they avoid it 3 hours. You can still have a glass of wine with dinner or things like that. But as much as you can, try to get the alcohol intake away from bedtime as much as you can. And here's just a little tip for nighttime cravings. Sometimes it's like, okay, I'm just feeling snacky. I just want to eat something. I'm not even really that hungry, but I just feel like having something would be helpful. Then this can be really, really helpful using apple cider vinegar, hot water, drizzle of honey, and lemon. Really, really good for kind of changing the palate so that you're not starving before you go to bed. And it can really help with cravings. In fact, you can do this like right after dinner if you kind of choose not to eat after that time frame. Little trick. I suggest trying it out. Let me know how it goes. And apple cider vinegar is, in my opinion, terrible when you have it like without this type of setting. And so I used to try taking like an apple cider vinegar shot, for all the health benefits, right? And I'm like, this is terrible. I would rather not have the health benefits than to ever drink this stuff again. When you do it in this setting with the honey, lemon, hot water, it is so much better. So try it out. See how you think. Or see how you like it. Okay, so let's shift to the morning. All right, so we know about things that we need to reduce before bedtime or things that we can work on in the morning. So do you know that you can produce more melatonin if you start getting daylight into your eyes within the first 30 minutes of waking? It's a little bit more tricky if it's still dark out when you wake up, of course. You can get one of those lights that can help you, that could be in your periphery. But having tangential light coming into the eyes, it doesn't have to be sunny, just daylight, preferably. Getting that into your eyes will start to naturally cause your body to produce melatonin. About really 12 to 16 hours later, your brain will start compensating compensating is not the right word. It'll start producing melatonin in that time frame. So we could naturally increase your melatonin dose in your brain. Also, things like resistance training earlier in the day if you can. I mean, I know that's not always possible. I will often do resistance training at like 5 p.m. to wake myself up for the evening a little bit, but you can try this out. Try doing some resistance training in the morning. Can help lower your evening cortisol levels, with the thought that if you stress your body too much, this is more important for those like high intensity interval training sessions or something that is kind of getting you really worked up in the evening. It just takes a long time to settle down after that. If you've ever noticed that, it's like, gosh, when I finish this, now it's going to take me 2 hours to go to sleep. So doing that high intensity type of activity earlier in the day just lowers your cortisol and just makes it a little bit easier to get some sleep afterwards. And it comes down to lowering your heart rate. It is incredibly difficult to sleep. In fact, many people will probably say it's impossible to, well, maybe that's extreme. It is much easier to sleep when your heart rate is lower. So we talked about lowering your body temperature. That does lower your heart rate. And another thing that lowers your heart rate is reducing your stress, which we're going to talk about. Taking a vacation from your problems, trying to reduce your heart rate. And we're going to talk about some things to actually do that. Oh, this is one of my favorite tricks, this 4-7-8 rule. So as you're watching this, let's try it together. Okay. This is going to reduce your stress level. It is also going to lower your heart rate at the same time. Do you know that at the bottom of your lungs, when you get to a full inspiration, it will naturally increase your parasympathetic nervous system. Sympathetic nervous system is fight or flight. We got to do things now. Parasympathetic is rest and digest. So we want more parasympathetic nervous system when you are trying to sleep. And this is a way to trick your brain into doing this, trick your body to do this. So 4-7-8. So you're going to inhale through your nose for 4 seconds. Then as much as you can, you're going to hold your breath for 7 seconds-ish, or you can just do 4 completely. If you can, just hold your breath as long as you can, maybe up to 7 seconds. And then you are going to exhale for 8 seconds, 4-7-8. That ratio for some reason just doesn't. If you do it right now, you'll already feel relaxed. In fact, many people will start yawning. It's like, I don't even want to do it because when I do it right now, I'm going to start yawning. It just works that fast. I have definitely used this in the middle of the night. Interestingly enough, it's so funny. Whenever I'm going to do a talk like this, I like experience whatever it is I'm going to be talking about. And last night I did wake up in the middle of the night. I did this breathing technique. And then next thing I know, it's the morning. So it really can help. It's one tool. So don't worry. We got plenty of tools if it doesn't work. Great one though. So the overcoming that productive mindset, who knows that when it's the middle of the night, you're thinking about the worst things ever, right? Like, what if this happens? Like nothing positive happens in our brains when it's, 2 a.m. It's like we're thinking about all these terrible things. Or if you're trying to get to sleep, it's like your brain is trying to go through all of these things. So what to do if you wake up in the middle of the night and you feel a certain way? Okay, we'll go through these different scenarios. So if you feel restful and you wake up in the middle of the night, if you're just kind of like, okay, well, I'm awake, but I'm fine, I'm feeling okay. In that situation, it's highly suggested that you stay in bed. When you get out of bed, what is the one thing that first happens? Your heart rate goes up because all of a sudden you're moving and you're doing things. Remember, we need our heart rate to be lower when we're trying to sleep. So as long as you're feeling content, stay in bed. Do you know that 60 minutes of this quiet wakefulness can actually equal 20 minutes of actual sleep? So take the pressure off yourself. Even if you're just laying there with your eyes closed and you're not sleeping, it's still doing something for you. Now, you might get to a certain point where you're like, are you serious? I am still awake. I am so irritated. Like I'm just sitting here and I'm just angry. That's a time where it would be best to get out of bed. Okay. So get out of your room if you'd like, go to a chair in your room or something like that. But get out of bed, do some type of low stimulation task. So this could be reading a book, for instance, in another area. Once you get that wave of sleepiness that comes back, go back to bed, do it again, and do the breathing rule. Good way to get back to sleep without being frustrated and agitated for the rest of the night because you're not really sleeping then. The first scenario was your body's at least resting, even if you're not truly sleeping. And a great thing is just to try and stay positive. Like I said, it just seems that a lot of these negative thoughts come up in the middle of the night. No problem solving in the middle of the night. Okay. You are going to give yourself permission to not problem solve. Okay. Don't start catastrophizing things. Say this to yourself. I will handle this in the morning. Right now, my job is to be comfortable, whatever it is. Like take captive those thoughts. And then that way you can choose to take a vacation. If anyone has ever seen What About Bob, that's one of my favorite movies. Okay. And the psychologist tells Bob, who's like really mentally disturbed, he tells him, take a vacation from your problems. So in the middle of the night, if you are awake and you're getting agitated and you're thinking about things, take a vacation from your problems. Think about all the things that you're happy about. Go through a thankfulness list in your mind about all the great things that are going on or how much I enjoy this person or whatever it is. Choose to think about those good, wonderful thoughts because that's also going to relax you when you do those things. If you need to write down something, if your brain's like, oh, you forgot to call that person, you forgot to whatever it is, pay that bill, write it down. Your brain will tell yourself you have done it. You have taken care of it. That way in the morning, you just pick up where you left off. So critical, important. So I want to talk about some supplements because there's plenty of supplements for sleep. And I really like to know, before I take anything, I need to know what is it doing for me. So, I mean, you could read the bottle of a supplement and you're like, oh, that sounds great. But there's a lot of marketing that goes on too, right? So it's important to really only take something if you actually need it, right? So magnesium is one of the most studied supplements, very, very studied. Many people are already deficient in magnesium because the soil really doesn't contain a lot of magnesium. So many people are deficient in it. So it can be helpful to take anyway for those reasons. It doesn't matter a ton about the type of magnesium that you do take. These ones in particular, the glycinate, aspartate, and gluconate, these tend to be better absorbed formulations. So it's something that you can consider. Magnesium also supports your muscles and your nerves, and it can help reduce inflammation, which we all need, right? And studies show that it can significantly improve sleep and help with muscle pain. Some people are just sore in the night, or they can't stop moving their legs or things like that. So magnesium can help with all of those things. Sermorelin, this is a peptide. So this is taken as a subcutaneous injection. It can stimulate your body's natural growth hormone production, and it has been linked to better sleep and better muscle tone. Very different things, but actually does help in both those ways. It's amazing actually how much better people can sleep on Sermorelin. Usually, I've never heard of anyone not sleeping well within that first month of taking it. I'm sitting here thinking, everyone I've put on it previously has seen a dramatic increase in their sleeping within that first month. So something to consider. Vitamin D. Do you know, this is so interesting, that vitamin D deficiency is linked by studies to poor sleep. Many people are deficient in vitamin D if they're not already taking it. It's hard to get enough from the sun. The way I learned it in school is you have to be like walking around naked with no sunblock on to get enough vitamin D from just the sun. Obviously, you can get it from food intake and things like that, but many people do need to take a supplement, so it can be very helpful. Interestingly enough, it is absorbed better when you take it with magnesium, so those two can be taken together. L-theanine, wow, this is a really interesting supplement. So this is an amino acid. It promotes relaxation, and that can also make you drowsy. So interestingly enough, it works on GABA. I mentioned earlier that alcohol works on GABA. Benzodiazepines also work on GABA receptors, so L-theanine does, but typically from a more safe standpoint than those other two components I mentioned. And it also helps to improve dopamine. For women in perimenopause or menopause stages, it can be helpful at quieting those racing thoughts before bed. Actually, really, it can be helpful for anyone with racing thoughts before bed. I know I see a lot of women that have that, but really men and women can suffer with those horribly racing thoughts before bed, almost just like this anxiety that comes up. Ashwagandha, which so many people take, is very good at lowering high cortisol levels. And we know cortisol is not conducive with good sleep. So we want to lower cortisol. So ashwagandha can help some people with sleep. Valerian root actually works as a mild sedative, and it's just kind of similar to melatonin. It's best for falling asleep. Maybe not as helpful for staying asleep, but it can really be helpful for falling asleep. Melatonin, we talked about a little bit already, helpful for falling asleep. It's also really good for shift work. There's a lot of people that will work nights. They'll try to sleep during the day. And that's when it can be most helpful because, again, your body's in this cycle. It'll naturally start producing melatonin. So for those people that are trying to sleep when their melatonin is very low, it can be very difficult. So melatonin can be incredibly helpful if you're also like switching time zones or things like that when your body is not used to sleeping. That's great. Generally safe, especially when it's taken in doses up to 10 milligrams daily. Interestingly enough, the studies show that the efficacy tends to peak at about 4 milligrams, and then it tends to plateau. Some people have had different experiences, but just something to kind of consider. I thought this fact was so interesting that melatonin tends to work better if you take it a little bit further away from sleep. Most people will take it right before they go to bed, but it does take your body sometimes a little bit of time to digest it and break it down. So some studies show that taking it even up to 3 hours before bedtime could help. So it makes me wonder too, I wonder how many people struggle with going to sleep. They take melatonin, they say, then they still can't get to sleep for like another 3 hours. And then they say, melatonin does not work for me. Now with this study, it makes me wonder if maybe they just need to move it forward a little bit and take it a little bit sooner, because maybe it's just not really kicked in yet by the time they're starting to evaluate it. I appreciate this, this quote. Every almost everything will work again if you unplug it for a few minutes, including you. I love this because, it kind of helps take off this pressure of stress and the stress over sleeping. When you don't sleep well, it can really start to affect multiple areas of your life. As or if you or someone else that when they don't sleep well, it really starts to affect a lot of things. And so when we don't stress so much about sleeping and even take some of those components, like let me stay in bed if I'm following that algorithm. Okay, if I'm laying in bed, but I'm feeling okay, I'm just going to lay here because you know what? It's still doing great things for me. I'm still getting rest. I'm resting my brain. I'm thinking about good thoughts or just trying to clear my mind completely. That's still going to, if I do that for 60 minutes, it's going to be like I slept for 20 minutes. Doing these like deep breathing exercises, being kind to yourself, taking a vacation, right, from stress. I refuse to be stressed in the middle of the night. I refuse to be upset or worked up about things that is not my job right now. My job is to be restful and to take a break from those things. And so even unplugging can be incredibly helpful. Take the pressure off of yourself. And, a lot of times people have struggled with sleep for a long time. This didn't just happen overnight. For some of you, it did. For some people, they just started sleeping poorly. But it can take, a full month sometimes to really improve this. So don't throw the baby out with the bathwater, right? Just know that if something doesn't work, keep at it. These are tried and true ways to improve sleep, studied by many researchers over tons of studies. So even if it's not working that night, keep at it. Keep working on it. These things do improve. You can keep these things in mind, even even if you are on sleeping medications, you can still employ these things because they're going to be helpful for many different things that you're going through. And then, I put this in here, this sleepdoctor.com. There is a quiz if you want to take to find out your sleep type. We talked about those different chronotypes. So if you're kind of interested in that, there is a really good sleep psychologist. And if you go to sleepdoctor.com, he also has a cognitive behavioral therapy for sleep. That's one of his programs. I highly suggest it. If you're doing all of these things and you're still not getting anywhere, the most amount of evidence when it comes to sleeping is working on cognitive behavioral therapy. Very, very helpful. So highly suggest it. It starts with doing this quiz. Then it can lead you into some other information about cognitive behavioral therapy for sleep. Highly recommend it. And then you can reach out to me if you're interested in trying Sermorelin. If you are interested in using progesterone for sleep, that's something that I can help you with. But I hope everyone has a great night's sleep tonight. Thank you so much for listening in. Awesome being with you guys here today, and we'll talk soon. Awesome. All right. See you later.
Bye.
All right. Bye-bye.